So you've got runner's knee and you've watched about 1,000 videos, all basically telling you the same thing: to stretch your thigh muscles, foam roller, your IT band, maybe stretch your hamstrings and so forth, and none of it's working. So this video will take you through 3 tests to help you more deeply understand why you're likely having runner's knee pain and how to solve it. And this information will pertain to any type of knee pain, no matter what the name is that someone has given it: patellofemoral pain syndrome, arthritic knee pain, bursitis, runner's knee. It doesn't matter. All of these issues will pertain to any kind of knee pain. Let's get started. Okay, so what's going on with knee pain, or specifically runner's knee pain, or frankly any other knee pain that you're having? Well, it's important to understand that the knee is comprised of both a thigh bone and a lower leg bone, and then it has that kneecap on top of it. Likely, if you're having a chronic runner's knee issue, it's because there's a problem with the thigh bone, how it's being used, or the lower leg bone with how it's being used, that's being played out at the knee joint. So one of the first things I want to talk about is something called femoral retroversion and anteversion. They sound like scary names, but basically what they mean is that femoral retroversion means that the thigh bone is actually twisted outward a little bit, and we're going to test for that in this video. And femoral anteversion means that the thigh bone is twisted inward a little bit, and we're also going to test for that in this video. So you shouldn't consider these as anomalies. Everyone has a spectrum of rotation of their thigh bones. So in the test I'm about to show you, you're just going to determine how much rotation you have. Is it a lot? Is it a little? Do you have basically none? So this will help you think about why you're having knee pain. So let's get started with that test first. Basically, you're going to lie down on your stomach with your knees bent, and you're going to let your feet fall to the outsides of your body. And you're going to look at how far your feet are falling outside of your body. And if you can have someone videotape you from behind, this will help you see exactly the angles that we're talking about. And then you're going to straighten one leg down to the floor, and you're going to let the other foot fall across midline to the back of the other knee, and you're going to see how far that one goes. Are they moving at roughly the same motion? Can you move your feet out about the same degree as you can move your feet in? Or is there a difference between the two? So that's what basically we're looking for. So what are we looking at then in this video? So basically, if your feet can move out more than they can move in, then you have what's called femoral anteversion. And if you look at this skeleton here, if my foot is traveling to the outside, you can see that my thigh bone then is traveling inside. It's internally rotating. So this means you have excessive internal rotation built into your thigh bone. Now, people with anteversion, typically anteverted thigh bones are found in females, and typically what we need to do, because the hip joint and the knee joint don't like internal rotation, what we need to do is strengthen your external rotators to decelerate the internal rotation that may be happening. So that would involve a lot of gluteal strengthening and gluteus maximus, and I would also say likely gluteus medius too. Now, if you have a pronating foot or a flat foot occurring, when the foot collapses, it also rotates the knee in. So if you have flat feet, then you might want to try a pair of orthotics to help decelerate the amount of internal rotation that knee is going through. So that's if you have femoral anteversion. And again, that's if your feet can move out further than they can move in. Now, femoral retroversion, if your feet can move in further than they can move out, which will describe most guys doing this, then you have an externally rotated thigh bone. And so what is happening here is that your feet, by pointing your feet forward, then you are relatively internally rotating the thigh bone. The thigh bone this test is telling you that the thigh bone wants to be rotated out a little bit more, and that's how it will best be seated in the hip socket, and that's how best the knee will function. So when you stand and walk, the easiest thing to do for people with retroverted femurs is to start turning your feet out maybe 3 to 5 degrees to accommodate the thigh bone rotation that you've just tested that you have. Hopefully that makes sense, because now the feet will be aligned with the shape of the thigh bone and you'll no longer have chronic internal rotation stress acting on the knee and the hip joints. Okay, so the second test we're going to do is to determine how tight your calf and soleus muscles are. The calf and soleus muscles are found here in the lower leg system, and when we run, the knee needs to be able to bend over the ankle well in order to run well. So we're going to be testing out that system. Basically, you're going to step up to an 1.5 book, let's say, put the balls of your feet up there, lock your knee back, and then lean your body forward with that knee lock back. And this test is testing your calf length. And so you're going to feel how far you can lean forward, how tight that feels, and then you're going to compare that to the other leg. All right, so is there a difference between one leg, one calf, and the other calf? And if there is, likely the tighter calf is the side that you're having the runner's knee problem with. Now the second test is testing the soleus muscle. The soleus muscle is deep to the calf muscle. It goes up to about here on the lower leg bone and also inserts into the heel via the Achilles tendon. And having soleus length allows the knee to bend over the foot when you're running or going up and down hills or stairs or things like that. So here's how we're going to test that. We're going to use that same book. You're going to put the ball of your foot up on the book, the heel on the ground, and this time you're going to bend your knee over the first or second toe of that foot and you want to keep your heel on the ground. So you want to see how far can my knee bend forward? And you should feel a little tightness or stretch down here in the lower ankle area closer to your foot when you're doing that. And then you're going to take your foot off and you're going to compare it to the other side. Are both sides soleus muscles, do they have normal range of motion? And with about an 1.5 book, your knee should be able to come out at least to the tips of your toes when you're bending your knee forward. If you can't do that, then there's a little tightness there. And so you're going to compare both sides and see if you have one side that's tighter than the other. Likely the tighter side will be the side that you're having the runner's knee pain on, which means that the knee is absorbing the stress because your ankle isn't bending and absorbing that stress for you. So the best thing to do would be to stretch that out. And the reason that the calf and soleus muscle get tight is usually because of our sleeping habits. So I recommend something called a dorsal night splint. I'll put a link below to Amazon of the one that I typically recommend for my patients, but you can get any one that you want. Because I've found that our sleeping positions are what is causing the calf and soleus muscle to become tight in the first place. The goal would be to be able to sleep with the dorsal night splint through the night for 3 or 4 nights in a row, and then notice whether your runner's knee seems to be improving as you're able to sleep with that dorsal night splint on longer and longer. And I would only get one so that you can focus on just that tighter side issue. Now it is possible that you found that your calf and soleus muscles are tighter on the opposite side of your runner's knee, in which case that means that you are likely landing harder on the runner's knee side because of the tightness from the other side. So you're compensating. So again, you have to solve these kinds of problems. Okay, so the last test we're going to do is a thigh stretching test. So I've seen a lot of videos where, a runner is either lying down or standing and they're holding their thigh like this to stretch it out. And I don't like that at all because there are too many compensations that can occur in the spine and the pelvis to accommodate a tight thigh muscle. So the way I recommend doing it is lying down on a firm surface and holding both knees to your chest and making sure that your back is nice and flat into that surface. And then you're going to lower one leg down over the edge of that table or surface. It could be a dining room table, could be a kitchen countertop, could be your bed, although a firmer surface is better. And then you're going to lower that down with your knee bent at 90 degrees, and you're going to see, hey, can my leg get down all the way without me forcing it? Does this feel tight to me? Is my knee traveling to the outside when I do this, or is it staying in line with my hip joint? And then you're going to bring that leg up and you're going to test the other side. And same thing, can my leg get down with my knee bent at 90 degrees? Is the leg moving to the outside? Does it feel tighter than the other side? If you're tight on both sides, then I would stretch both sides. But if you're tight on one side or the other, then I would just focus more on that one side. I typically hold that stretch for about 60 seconds or longer, and then I do it twice to each side when I stretch it. And so what this does is it's isolating your back and your pelvis and making sure that the stretch is purely along that thigh muscle, rather than allowing your pelvis to torque and your back to torque to accommodate some thigh tightness there. If you spend about a week doing these things and fixing these things, that runner's knee should feel significantly better. Of course, there are many other problems that could be happening, and if you want more tests to test your lower body system, I have tons of YouTube videos about this, but more specifically, I just wrote a book called Pain Patterns, and I've made videos of each of the chapters on my YouTube channel that starts with this one. I would encourage you to watch all of those videos because they're going to take you through all of the tests that are in my book and help you dig down even deeper into why you're having pain. And so I've got those videos as well as literally hundreds of other videos on my website to help you identify why you're having pain and how to solve it. And I also have digital home programs to help people solve their pain. I have one for hip pain and knee pain. And so we're talking about runner's knee, so you would get the knee pain video, and likely it will probably solve all of these issues for you, and you'll be back out running in no time. If you have a pain problem that is stumping you and your practitioners, write it in the comments below. I'll be happy to try to get to it and make a video for you to help you understand it better. So I love to get those kinds of comments, and good luck.